Welcome to the City of Toronto's COVID media briefing for Wednesday, April the 1st, 2020. We're joined today by Mayor John Tory, Medical Officer of Health Dr. Eileen and Fire Chief Matthew Pegg, and General Manager of the Office of Emergency Management. We'll start today with Dr. Davila. Doctor?
Thank you, Brad, and good morning, everyone. So I'm here today to provide you with an update on COVID-19, looking in particular at where we've been over the past several weeks, where we are now, what we've learned from other jurisdictions and their respective COVID-19 experiences, and where I believe we need to go now as a city in order to achieve three primary objectives as we respond to this outbreak. And these objectives are to, as much as possible, reduce the loss of life from COVID-19, preserve and protect the capacity of our healthcare system to respond to and to provide care for those who need it, whether for COVID-19 or other medical conditions. And third, to minimize social and economic impacts of COVID-19. It's hard to believe, but as I am speaking to you here today on the 1st of April, although many of us feel like we can hardly remember a time before there was a COVID-19, I recognize that it has been only 91 days since we welcomed the new year. 84 days since Toronto Public Health issued its first statement about what we then referred to as the novel coronavirus. 64 days since we had our first confirmed case in Toronto of this new viral infection. And 50 days since the World Health Organization gave the disease caused by this new virus the name COVID-19. I could continue counting down the days, marking significant events and occurrences related to COVID-19. But no matter how we look at it, I can simply summarize it as this. COVID-19 has had a dramatic impact on our world and on our city. This virus, this new coronavirus, which was only discovered in early January, has given rise, as of yesterday, to almost 900,000 cases of COVID-19 and just over 42,000 deaths globally. Here in Toronto, we have been monitoring COVID-19 activity since the beginning of the year. Our first case was confirmed in late January. And fast forwarding to March, just 2 weeks ago, on March 18th, Toronto had 102 confirmed cases and 43 probable COVID-19 cases. 10 people in hospital and 4 people in intensive care units. On March 23rd, our numbers had climbed to 239 confirmed and 65 probable cases of COVID-19, with 14 individuals in hospital and 5 in intensive care beds. And as of yesterday, March 31st, we reported 628 confirmed and 165 probable cases of COVID-19, with 65 people in hospital and 33 in intensive care units. So to make this patently clear, in terms of our case counts, in the last 2 weeks, we have seen a more than 500% increase in these counts. This is not a favorable trajectory. And as your medical officer of health, responsible for protecting the city's health, your health, I am deeply concerned. In addition to studying our own circumstances here in Toronto, we at Toronto Public Health have also been carefully monitoring the experiences and the approaches taken by other cities and countries around the world. We have observed the comparative successes of countries like South Korea and Singapore, where case counts and the number of deaths have been significantly mitigated. And we have equally observed the challenges faced by places like Spain and Italy, where more than 10% of cases have died as a result of COVID-19. Closer to home, we have also very carefully monitored the experiences of New York City. Although it was not until March 1st that New York City reported its first case, by the end of the day yesterday, only 1 month after reporting their first case, New York City's case count for COVID-19 was almost 42,000, and their reported deaths numbered almost 1,100. And while the situation in New York City has certainly captured our attention, being so close to us here in Toronto, we know that similar situations are occurring in cities all around the United States, including Chicago, New Orleans, and Seattle, just to name a few. So I realize that I depict a very stark picture here, a very stark picture, but one that is honest and true and premised on the data that we have in front of us. Given this is our current situation, it is my belief that we must absolutely implement stronger measures to avoid the type of results that we are seeing in places like New York City. One only has to look at the news to see what is happening there. Our colleagues in New York, unfortunately, are seeing a substantial loss of life, an overwhelmed healthcare system, and are experiencing significant social and economic disruptions, which are happening right now, and I expect will have impact for many, many weeks and months to come. This outbreak, as we've said many times over the past several weeks, is truly an unprecedented situation. And as such, I feel the need and the obligation to you, the residents of Toronto, to use my powers as your medical officer of health to the greatest extent possible to save lives, to reduce the impact on our healthcare system, and ultimately, as well, to mitigate social and economic impacts on our city. So with this in mind, I am using these powers as medical officer of health, every power I have available to me to make new measures, to recommend new measures based on the experiences from jurisdictions who have managed outbreaks successfully. First, I am implementing strengthened case and contact measures. As you may have heard me say many times, case and contact investigation is the foundation of our work in public health when it comes to communicable disease control. We always do this with the greatest of care and seek to achieve the objectives of reducing the spread of communicable disease. However, given these unprecedented circumstances, I shall be issuing class orders under the Health Protection and Promotion Act in order to emphasize the significance of self-isolation for those who are diagnosed with COVID-19, those who are suspected of having COVID-19, and those who are close contacts as identified and contacted by public health in respect of COVID-19 cases. My understanding is that my provincial counterparts are pursuing similar orders for the province as well. And I just want to emphasize that this represents an enhancement, an augmentation of the work that we're already doing, and it is to emphasize the importance of those individuals who either are diagnosed with COVID-19 or are suspected of having COVID-19 or at high risk of having COVID-19 infection to self-isolate in order to reduce virus spread. Second, I am putting forth measures to enhance social distancing, to enhance physical distancing. For those of you who have been listening to our briefings for the past few weeks, you'll know that we have been speaking to the notion of physical distancing for quite some time now. But today, as your medical officer of health, I am saying in the strongest possible terms for the public to stay home as much as possible and only to go out for the most essential of needs. Things like accessing health care or getting medication. Limiting outings to get essentials like groceries as much as possible, ideally once a week, and where possible, even better if those groceries can be accessed remotely online. Walking pets and getting daily exercise are also seen as reasonable things to do while trying to stay home as much as possible. However, with all of these outings, I would remind members of the public to maintain physical distancing while out. But I can't emphasize enough that I'm using the strongest terms possible to advise the public to stay home as much as possible and only go out when needed for essentials. Second, in respect of enhancing social distancing or enhancing physical distancing, I am seeking to work with our provincial partners to reduce the number of open workplaces and businesses. To be clear, it's not within my jurisdiction as the local medical officer of health to make determinations as to what businesses can remain open. But I assure you, we are working here at the city to actively engage our provincial partners to see what can be done to reduce the number of open workplaces and businesses so as to reduce virus spread while at the same time meeting essential needs. So we will be focusing these conversations on essential retail and services and ensuring that those businesses are able to operate and provide the services that are needed, but to do so in a way that either maximizes remote opportunities, online opportunities, on-call opportunities, so as to maximize physical distancing, and for those businesses that have no option, where in-person services must continue, for those businesses to maximize physical distancing where possible and to engage in increased cleaning and active staff screening. Again, all with a singular focus on reducing virus spread and balancing that with the provision of essential services. Next, I propose enhanced follow-up for recently arrived travelers. As we know, our partners at the federal level of government have already issued orders under the Quarantine Act requiring that all travelers who have returned from travel outside of Canada are to self-isolate for a period of 14 days. This, like many other measures, have been put in place. This order has been put in place so as to reduce virus spread within our community. Through this measure, I'm proposing enhanced follow-up of these orders through the coordinated efforts of the federal, provincial, and local levels of government, all working together to better ensure adherence to the quarantine orders as already issued by our federal partners. And finally, I'm proposing greater protections for those most vulnerable to COVID-19. I commend my provincial counterparts for the measures that they have taken to date, the strong recommendations that they made earlier this week for those in our communities that are 70 years of age and older to stay home as much as possible. I recognize as well, though, that there are other populations within our community, within our city, that are also vulnerable to COVID-19. Those experiencing homelessness and those who reside in long-term care and in retirement home settings. I propose that we work together at the city level of government and particularly with our provincial partners to ensure that better measures are in place to support, for example, the ability of those 70 years of age and older to stay at home as much as possible. And I think that we can do this not only in partnership with our provincial counterparts, but as well in partnership with members of our volunteer sector, our not-for-profit sector, and our private sector. There are a number of other measures to help support social distancing efforts, physical distancing efforts, and infection prevention and control in settings that homeless individuals use and reside in, and those as well in long-term care settings and retirement home settings. In respect of the timing of these measures, I propose that we effect them immediately and that we seek to implement those that are on this list as quickly as possible. Based on the experiences of other jurisdictions, it is my belief that these measures may need to be in place for up to 12 weeks. But I would tell you that how long these measures need to be in place, how successful we are in terms of controlling virus spread, is entirely in our hands. The more we are able to put these measures into place, the more we are able as a community to adhere to these measures, to adhere to the recommendations. The shorter will be the duration of these measures, and the more effective we will be, most importantly, at reducing the loss of lives in our community. As well, I think it's important to note that the more we are able to adhere to these measures, the more successful we will be in terms of preserving and protecting our healthcare services, which are so important to us as a community. We will certainly monitor, as we have been doing for the last several weeks, the progression of the virus in our community and observing not only what we see here in our city, but what is happening elsewhere, in order that we can adjust our timing and the measures in a data and evidence-informed manner. Again, the goal of all these measures is to reduce the loss of life, to preserve the capacity of our healthcare system to respond to our needs, and to minimize, wherever possible, both the short and long-term economic impacts of this disease on our community. In conclusion, I would say that the more as we can, as Torontonians, rally together for the next 12 weeks to comply with these measures, the more we can make it through this challenge and protect ourselves, our loved ones, and our entire city. Thank you for your attention, and I'll turn it back over to Mayor Tory.
Good morning. Last weekend, I asked our outstanding Medical Officer of Health, Dr. Eileen who you've just heard from, to outline for me and for the senior leadership of our COVID-19 crisis management team where the City of Toronto stood and where things were likely to go for our city as events continued to unfold. What she said that day made it clear that there were steps that we could take in our own city, unique as it is in all of Canada, which would give us the best possible chance of avoiding a fate such as that being experienced by New York City, only an hour away by plane. In the subsequent 2 days, we have been busy planning for the implementation of these new measures just outlined by Dr. Davila and ensuring they are compatible with the welcome measures already undertaken by the Government of Canada and by the Government of Ontario. I also asked Dr. Davila to share her perspective and her recommendations with the people of Toronto, which we're doing this morning, so that all of the facts were on the table for the people we serve, the same people that we are pledged to protect. We owe that to you and to your families. I think people need this information in order to understand just how deadly COVID-19 is and the devastating impact that it could have on our city, as we have seen happen elsewhere. Today, Dr. de Villa has laid out a prescription for all of us, and I will do everything in my power to make sure that our city follows that prescription, and in so doing, that we will defeat this deadly virus. I fully support Toronto Public Health issuing mandatory isolation orders for those with COVID-19 under the Health Protection and Promotion Act. We have to make sure that people are not spreading this virus further in our communities. The provincial government has announced similar action province-wide this morning, a welcome step as part of our ongoing collaboration with respect to COVID-19. This will be accompanied, as the doctor outlined, by enhanced case and contact tracing, the detective work that our public health officials do to help trace the path of the virus and notify those who may have been exposed before they unknowingly spread it to others. These actions are unprecedented, but we are facing an unprecedented threat. The speed at which this virus has spread in cities around the world, including in New York City, make urgent action mandatory. Given that these measures are unprecedented and do represent strong medicine, I think it is important that I tell the people of Toronto that I strongly support Dr. de Villa in recommending that people, every single one of us, stay home as much as we possibly can, and only leave home once a week if that is possible for us to abide by that limit. Only leave home once a week to buy essentials, and if possible, do it for someone else to save a trip that they might make out of their homes. Seniors over the age of 70, please stay at home for your own protection from this virus. The city is working to help seniors to make sure that they get essentials while they are in isolation, but it is by far best they should remain in isolation. Long-term care homes need to take action now, as recommended by Dr. de Villa, to further limit who comes inside, how we isolate seniors in long-term care who are ill or at risk, and through a ban, for example, on group meals. And then we as a city have to take further action to further protect the homeless and make sure that they are physically distanced from each other in our shelter system. The medical officer of health has been clear that the healthcare system depends on these actions. A failure to do so will result in its inability to cope. That would cost lives. The sacrifices we are asking people to make now will save lives and allow for a quicker recovery. I think that is what most people want us to do, to save lives, to protect the healthcare system, and to limit the damage to the economy and to the lives of Torontonians. The advice of public health professionals has guided us throughout this crisis, and that will continue. That is continuing this morning, and it must continue going forward. We have already taken action, and I want to thank the vast majority of people who have helped us by following those recommendations and directives. Toronto and other governments have closed public buildings, restricted travel, limited restaurants to takeout and delivery, prohibited public gatherings, cancelled events, closed playgrounds, and more. These measures have had tremendous economic consequences. They've hurt people's livelihoods. They've made life more difficult for people in many different respects, but they have already saved people from falling ill and possibly losing their lives. But as we continue to fight COVID-19, it has become absolutely clear that this is going to be a very long battle and that there is more to do. The numbers are presently headed in the wrong direction in Toronto, and our doctor says it is time to act. And assume it will likely be up to the 12 weeks that the doctor has outlined, with temptations not to follow these measures increasing as the weather improves. We must show strength in sticking to this game plan so that by the time summer comes, we have turned an important corner. Much of what we've been asking people to do by way of physical distancing and isolation is about saving lives and protecting health, but also it is about giving you back your lives as soon as possible. Nous sauverons des vies, nous garderons les gens en bonne santé et nous ramènerons la ville de Toronto à la normale, plutôt si nous suivons les conseils de notre médecin. Restez à la maison, gardez vos distances les uns des autres, restez loin des groupes. Si nous le faisons, des vies seront sauvées et ce long cauchemar prendra fin. I believe most people want this over as soon as possible. In fact, I can't imagine there'd be anybody that doesn't want this over as soon as possible. And if given the choice, they will do what it takes to end this situation at the earliest possible date, which, being candid, likely means the 12 weeks referred to by Dr. Davila. You want to go and visit and give a hug to your mother or your grandmother as soon as you can. You want to go out to a restaurant and sit on a patio and have a beer. You want to watch your kids once again able to play on a playground without restriction. You want to enjoy a summer festival, go to a Blue Jays game, hang out on the beach with friends. You want to take your dog to an off-leash park once again. Getting to those better days will depend on our collective response as a city. We have it in our control to make those better days come sooner. Dr. Davila believes that the additional actions being announced today, locking the city down as much as any municipal government possibly could, will save lives and turn that curve down and bring this wave of the pandemic to an end earlier than would otherwise have been the case. But we have to follow what she is recommending. We have to follow what she is directing, or we could face even more months of disruption to our lives, which none of us want. This is not an easy decision to make, and I am wary of the impact that it will have on real people in our city. But I believe it is necessary to protect the public and save many, many lives. That is our job, to make the decisions that will save lives, protect health, and give you your lives back at the earliest possible date. That is our job. So let's come together and show the world, as we've done so many times, who we really are. Let's do that. People who rally when there's any kind of a threat to this city and to its people. When some of us are in trouble, we do the right thing for all of us. That's what we do. We support each other and we do the right thing for all of us. People who are strong enough to overcome any challenge that is sent our way. People who will use our diversity and our smarts to get through difficult times and to support each other on the way through. This is a tough day, and there will be many tough days ahead. But we will deal with those tough days starting today and push through so that we can avoid really dark days. This city gives me hope every single day. There are things that go on in the city that give you hope every single day, without exception, even today when things sometimes might look bleak. I want today's announcement to give you hope. I want for us to give hope to each other. That's really important, that we give hope to each other and take hope from these announcements today. And I promise you that if we know what we have to do and we do what we know we have to do, then we will emerge stronger and better than ever and still be what we are and what we have been for a long, long time, which is the greatest city in the greatest country in the world. Thank you very much for your attention, and now I'll turn it over to Chief Pegg.
Thank you, Mayor Tory and Dr. Davila, and good morning. The City of Toronto has been working proactively on the planning for and response to COVID-19 since mid-January, before there were any cases of COVID-19 in Canada. The City of Toronto's emergency plan provides a robust framework for emergency management that is both scalable and agile. We are well equipped to respond to all aspects of complex emergencies as they occur. From the initial onset of COVID-19 in Toronto, we have built and continue to operate an incident management system that enables the city to make timely, effective, and balanced decisions. The foundation for our incident management system is the establishment of the overarching strategic priorities for the emergency incident. This is the process that is employed at thousands of fires and other emergencies every year in Toronto, and is the same process that is in place for COVID-19. There are 3 overarching strategic priorities that guide each and every decision we make in the Emergency Operations Center in response to the pandemic. The first priority is to save lives and to prevent as many people as possible from becoming ill from COVID-19. This is our top priority in all that we do. The second priority is to do everything that we can to prevent our healthcare system from becoming overwhelmed. Our third priority is to do all that we can to protect Toronto's economy and to limit the social and economic impacts associated with the response to COVID-19. Each and every decision that the City of Toronto makes in response to COVID-19 is made with the intention of saving lives, protecting our healthcare system, and protecting our economy. Dr. Davila and the Toronto Public Health Team provide the City of Toronto and our Emergency Operations Centre with expert advice, guidance, and recommendations to limit the spread of this terrible public health pandemic. As the head of the City's Office of Emergency Management, it is my responsibility to ensure that we efficiently and effectively translate the advice and guidance of our Medical Officer of Health into plans and actions that first and foremost save lives. Our corporate and senior leadership teams, our Emergency Operations Centre, and our entire City staff team have been working non-stop to achieve these goals. Toronto has been out front of COVID-19 since before it arrived in Canada. We assembled the COVID-19 Planning Task Force early and built strong and responsive plans. We have continued to remain abreast of this public health emergency as it has developed, and have continued to respond with action plans that are based upon the very best expertise, advice, and guidance. And now, as Dr. Davila advises us of the rapid COVID-19 escalation in our city, we are responding in kind with strong, balanced, and focused action plans. The actions being taken are not easy and will undoubtedly impact us all, but they are necessary if we are to save lives and avoid overwhelming our healthcare system with patients suffering from COVID-19 infection. Dr. Davila has been very clear. We still have a window of opportunity to reduce the spread of COVID-19 in Toronto. Our team will not stop until this is behind us, and until we have resumed normal life in the busy, vibrant, strong, and healthy city that we all love. In response to the Medical Officer of Health's recommendations to scale up our response to COVID-19, and in order to protect our most vulnerable, the Emergency Operations Centre has developed detailed plans that provide food for those who need it, including those in isolation, increased protection and support for those in long-term care and retirement homes, and a rapid housing program to ensure that a room is available for everyone who needs one. Over the past number of days, we have been working non-stop on the development of these comprehensive emergency plans. The details and specifics of these plans will be made available publicly over the next few days. I would like to thank Dr. Davila and the entire Toronto Public Health team for their unwavering commitment to beating COVID-19. Both Mayor Tory and Toronto City Council have been very clear from the outset. The City of Toronto will take every action available to us to beat COVID-19. Today's actions are an important and critical step that will save lives, will protect our healthcare system, and will protect our economy. Thank you.
Thank you, Chief. We'll go to questions now. Just a reminder to journalists online, there are a number of you today, so please, one question and one follow-up. Christina from CP24, go ahead.
Hi there. Thank you, Brad. Just to be clear, I have two questions for Dr. Davila and two for the mayor, so I can gladly get back in line after my first two.
Yes, please.
My question, sorry about some audio issues here. Okay, my first question is for Dr. Davila. So what you're saying today, the first item is, you said strengthened case and contact measures. You said class orders. Can you clarify what you mean by a class order and what kind of powers you have as the medical officer of health. What I'm wondering is what consequences are there for people? And what my initial concern was, and I'm seeing a lot of this online, is what is any different from what you're saying today than anything you had said before, unless there's some kind of strict consequence or enforcement measure?
So thanks for the question, Christina. So to be clear, there exists public health legislation. It's called the Health Protection and Promotion Act. And it's an act that we use in order to protect public health. We use it only when necessary. It does also provide the structure for public health as an aside. But in terms of communicable disease control, I think you've heard us say at this table many, many times that what we try to do in public health practice is to seek voluntary compliance with any measure in order to protect public health. That tends to be the most effective method by which to achieve public health objectives. In this case, we've talked several times about reducing the loss of life, protecting health care, et cetera. But in communicable disease control, we do try to use voluntary measures where possible. Only when we have to do we resort to the use of orders. Orders that specifically delineate, they explain very clearly what actions are required of particular individuals in order to achieve communicable disease control in our community, in this case, COVID-19. And normally we issue such orders under this public health legislation one by one on specific individuals. In this case, not very often done, but we are doing it here. We're pursuing what is called a class order. So it identifies a group of individuals. And in this case, what we are talking about are people who have COVID-19 infection, are suspected of having COVID-19 infection, or those who are at high risk, close contacts of those who have COVID-19 infection. And I'm simplifying there, but just to give you a sense as to whom this order is directed. And it actually very clearly stipulates what actions are required. Staying at home for 14 days. What does self-isolation look like? And these are the standards to make it patently clear what is being asked of those individuals. There are enforcement measures under the Act. We have had to use those before in respect of communicable disease control. My hope is that we do not have to go there, but to use the order first and foremost to explain to people what they need to do to make sure that there is no uncertainty around what is expected of them in order to control virus spread.
Second question,
Thank you
Christina?
for your reply. My follow-up question for Dr. Davila is you are concerned about some of the essential services on the province's essential services list. And you said you're working with the province because it's outside of your powers to shorten that list. What specifically are you concerned about on that list that's currently open that perhaps doesn't need to be open in this city?
Well, you know, Christina, I think the issue here is how do we actually enhance, how do we maximize our capacity as a city to practice social distancing or to practice physical distancing? So there is a long list that has been produced by our provincial counterparts of essential businesses, and I recognize that it's not always easy to delineate what is essential from what is non-essential. So for example, in order to run a grocery store, which I think we can all agree is essential, food is a fundamental need for each and every one of us. Clearly the grocery store has to be open, but there are a number of businesses that are required in order to put food on the shelves. So I recognize that that's not a simple calculation to do, but I'm exploring the opportunities along with city partners here to have those discussions with our provincial counterparts to see what we might do. How might we practically implement enhanced social distancing, enhanced physical distancing, while still ensuring that those essential services and businesses are available to meet our needs. So that's the goal. But fundamentally, you know, I have to make the point that really it's what it's about is enhancing physical distancing. We need to reduce virus spread. We still need to meet our needs. How do we balance these two very important factors into the discussion? That's what the discussion is all about.
May I just add one thing, which is I think it's been fair to say that the province has been willing to engage in those discussions, and in the end, as the medical officer pointed out, it is their legislative authority that has to be exercised here, and their list that is perhaps suited to some amendment and modification, but they've been willing to engage in those discussions, and we will also be seeking to, through the medical officer of health, to see if there are ways in which you might be able to leave a business open but constrain, to some extent, as she said, how long it's open or how it serves people, so as, again, to minimize the spread of the virus. But they've been quite open to having those discussions.
Okay, thank you. We'll go to Austin Delaney now from CTV.
Dr. Davila, Mayor, Chief Pegg, have you thought at all about using the Toronto Police Force to patrol and remind people they see that are not social distancing?
May I start off by saying that we've seen in cities where they're going through this, as we are, that the police have performed a very useful role, starting with educating people, sometimes as simple as coming up in the car or walking up on the beat and just saying to people, you shouldn't be together like this. And in many cases in other cities, as here, people are following along with that. So I'm sure that all the different people, whether it be bylaw enforcement officers, police officers, but mostly, isn't it best that average citizens should do that for each other? And should remind people that we are not supposed to be in groups, we are not supposed to be close to one another, and that we should try to address that problem in that particular manner. I should tell you that there is a bylaw that has been drafted at my request to enforce social distance limits set on the professional advice of the medical officer of health. And we've not brought that bylaw forward at this time, but it is drafted. And if it's necessary for us to use it in order to try and create a greater sense of adherence to these very reasonable recommendations that are being made to stop the spread of this virus, then that will be proceeded with.
And Austin, what I can add is I can assure you that Chief Saunders, as the Chief of the Toronto Police Service, sits personally as a member of our Strategic Command Team in response to COVID-19, as well as senior members of the Toronto Police Service are active every day in our Emergency Operations Centre. We are directly connected on all aspects of enforcement that include police, include a number of city officials, of course, in direct response to the advice and guidance being provided by the Medical Officer of Health. So I can confirm for you that every agency, every division, including Toronto Police, are directly connected with us on all aspects, including enforcement.
Did you have a follow-up, Austin?
As a follow-up, Mr. Mayor, can you please expand on the bylaw that you've drafted? Does it include fines? Does it include jail? Is it just for social distancing?
It's for social distancing. Let me start that again. It's for social distancing, but of course it could apply only to city property, which is a large part of the city, the sidewalks, the streets, the parks, and different places like that. And of course, any bylaw does have to contain some sanctions in the event that people don't follow it, and of course there would have to be some enforcement undertaken. And again, the strong wish all of us would have, including people like the police and bylaw officers who have other things they could be doing, is that we should police ourselves. And we should, get in this together and make sure that we do what we're being asked to do here. It's kind of like all of us have had doctor's orders before. Well, this is some orders that are coming from our doctor. And just like they say, stay in bed if you're not feeling well and take all the pills until the bottle is empty, we're being told some things we can do here as people to follow the doctor's orders. And of course, when you follow doctor's orders when you're ill yourself, you get better if you do what you're told. And so in this case, we've been given very clear advice, and this bylaw, if necessary, would help spell this out in clearer terms, but I hope it's not necessary to bring it forward, and I hope it's not necessary to have enforcement take place under it, because it's better if we just do this ourselves.
Okay, Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. So just to specify, I think what the change is here is that previously these were recommendations and now people are being ordered to do this. Is that right?
So with respect to the, with respect to the self-isolation for those that
Yes,
are COVID-19 cases are suspected, this is a stronger measure, absolutely. The advice is still the same. The treatment, as it were, is still the same, but now with the enhanced addition of orders.
So if I can have a follow-up question on that, is this because you're seeing people who have been traveling or people who have been in contact with people who have COVID-19? Is this because you're seeing them not voluntarily self-isolating?
Well, that has certainly been part of the issue that we've seen here thus far. We have heard some challenges in respect of compliance. That being said, I can assure you that as part of our case and contact investigations, we are following up with individuals to the greatest extent possible. That will continue with these new and enhanced measures put into place for case and contact investigation. But as the Mayor has just said, orders notwithstanding, I think we have to really focus on the role that each and every one of us can play here. And that includes those of us in our community that have been diagnosed with COVID-19 or are suspected of having COVID-19 or are at high risk of having COVID-19 through close contact. If all of these individuals strictly adhere to self-isolation, we can successfully reduce a significant component of virus transmission here in our city.
Okay, we'll go to Mark McAllister from City News. Mark?
Mayor Tory, perhaps Dr. Davila, if you can. This sounds like a bit of a challenge to the province, to the federal government, to perhaps other cities to take it this far as well. Is it, and why?
What it represents is exactly what was said by all of us, which is that we sat down as a group and decided what we could do within the mandate of the City of Toronto, and taking into account Toronto's unique characteristics. I mean, it is the biggest city in the country. It has a huge number, hundreds of thousands of senior citizens. It has a density of population that is probably different than any other place in the country. It has a homeless population that are in need, and other vulnerable communities that are in need of special care. So we have done everything that we can do within the powers and authorities of the municipal government to address the spread of this virus. And we have said today, all of us in one way or another have said that we are doing this in cooperation with the other governments. We have worked with them throughout, from the beginning, and we will continue to do so. And so they have different considerations to take into account, whether it's the province that has many, many other cities and communities across the province to decide what is best for other communities, or whether it's the federal government that has an entire, quite complex, vast country to take into account. But I will just say to you, we are working well with them. They're aware of what we're doing today. We've discussed it with them. We've discussed how we can be effective at this together, and that is the spirit in which we will go forward, working with them on all of the things that we've talked about today.
I think if I can add further to that, Mark, you asked me the same question. As I made mention of in my remarks, it's my job as Medical Officer of Health to protect the health of the residents of this city. And so with that in mind, and knowing the circumstance that we're in with COVID-19, my job here is to ensure that we do everything we can, that I do everything I can to ensure that we save lives, protect our healthcare system, and get our city back. So, you can characterize it as a challenge if you wish to others. I don't see it that way. As you've heard the Mayor say, we've been working very actively with other partners. So fundamentally, when I look at what it is that we're doing, and how we're keeping our objectives very firmly in mind, what I characterize this as is, frankly, discharging my obligation, doing my job as Medical Officer of Health for this city.
And a quick follow-up, Mayor, just on the potential bylaw that you have drafted. This has been posed as a potential lockdown on a municipal level, and yet it seems as though you still have something in your back pocket. So it's not quite to that point yet. What does it take to reach that point where you put everything on the table and really do lock down the City of Toronto?
Well, I will put this in a positive way. I remember just a little less than a year ago, this entire city, in fact, it seemed the day the parade was held, everybody in Toronto came out to the parade. It posed a bit of a challenge for us, but everybody was out behind the Raptors during the lead up to their championship win. And we need people now on their own, as they did. Nobody forced them to go out to Jurassic Park. Nobody forced anybody to come to the streets and come to Nathan Phillips Square to celebrate the win. We need a win against this virus. We need our lives back. We need the life of the city back. And I hope that what's happened today with the Dr. Davila, as she say, discharging her obligations, me discharging mine, the Chief discharging his, that we will show the leadership that people now need to follow our doctor's orders. And we've proven we've done it on something that was more fun, like the Raptors. Well, now this is serious. And so we'll see. I just hope that we don't need to pass a bylaw that tells people the obvious, which is a hockey stick's length, 6 feet, whatever we want to say by way of measuring it. Stay away from other people for now. And we'll get back to the hugs later. But for now, stay away from other people. Stay home. And do all those things that Dr. Davila has recommended, and we can put this behind us in much shorter order and with much less loss of life and trauma than if we don't do that. So we'll see how things unfold. I'm optimistic.
Okay, we'll go to Jennifer Pagliaro from the Toronto Star. Jen?
Hi there. For Dr. Davila, I'm wondering, in the U.S. we saw data yesterday saying that up to 240,000 Americans could die as a result of the virus. Have you seen any similar modeling for Ontario? And if so, can you tell us what those numbers are?
So thanks, Jennifer, for the question. You talked about the U.S. modeling estimates in respect of potential deaths associated with COVID-19 there in that country. And those numbers were pretty stark. If I've got them right, the predictions that were put forth through their models said that there could be as many as 100,000 to 240,000 deaths in the United States over the course of the outbreak. And those are pretty sobering statistics, I would say. When I think about modeling, just for the benefit of those who are perhaps less familiar with this, it's using mathematical tools to try to estimate what might happen in the course of an outbreak. And so this is a tool that is used in public health practice. But when you use this kind of tool, it's actually better done because these are estimates. It is actually better done at a larger level when you have larger numbers. So while it can be done at a smaller level, like at a city level, it is most frequently done, at a level of a state, or in our case, a province or a country, in order to get sufficient numbers, to get the most accuracy, to get the most utility, the most value out of the modeling exercise. So, I have heard in recent days of some provincial models that are out there that project where we might be going in this province. We've heard of other models for other provinces, but I have heard of models that have been used here for our particular case in Ontario, and I know of others at the provincial level as well, using those higher level numbers, where they've taken models from other jurisdictions and tried to extrapolate them here to Ontario. But in order to get the most accurate information around those provincial modeling efforts, Jennifer, I would refer you to my provincial counterparts for the details.
And just to follow up on the enhanced measures, so I'm understanding that there are orders now for those who are confirmed, suspected, or close contacts. What does that mean in practice, though? Are there going to be people ensuring that those stay home? Are those bylaw officers? Are those Toronto public health officials? What changes to ensure that you are seeing the compliance that we need?
So as is the case with all public health orders, or all orders issued under the Health Protection and Promotion Act, first and foremost, the follow-up, the actions are actually under the purview of Toronto Public Health. I know that we have been engaging in early conversation with our provincial partners around how we in Toronto, and I believe for other jurisdictions around the province, might seek to augment our public health workforce to support more enhanced case and contact investigations, but this would be under the purview of public health first and foremost. As I said, we always try to seek voluntary compliance with the recommended courses of action in order to control public health risk. Only if we have to do we then step up, whatever measures are available in order to achieve the objective. But fundamentally, the point of all the actions, education, enforcement, or otherwise, it's all about, saving lives in this particular case and reducing the impact on our healthcare system, and in the longer term, thinking about getting our city back and minimizing social and economic disruption.
Okay, we'll go to Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Hi, everybody. I wanted to ask, about the homeless situation. I know Chief Pegg mentioned rapid housing, but as of yesterday, activists are saying that there's still people in the shelter system sleeping well within 6 feet of each other. Given the tone and the measures that we're talking about, my kids can't go to the playground. Shouldn't we be acting way faster why is a single homeless person still sleeping within 6 feet of another homeless person in a city shelter as of last night? Why is that still happening?
So Jeff, to answer your question, I think I can speak at that at a very, very high level. We've heard from our colleagues at the Shelter Support and Housing Administration that they are working as expeditiously as they can with a wide variety of community partners to provide the safest environment for those experiencing homelessness in our community. These are very complex issues to address, but I can assure you, in the conversations that I've had with our counterparts at the Shelter Support and Housing Administration and the partners that they work with, they are doing everything they possibly can to address the situation. I have to tell you, we are very cognizant of the fact that those experiencing homelessness in our community are at high risk of negative impact associated with COVID-19. That is not lost on us. So please be assured that our colleagues are working as expeditiously as they can to remedy the situation.
And Jeff, what I'll add to that is I can assure you that within the Emergency Operations Centre, the supports required by our most vulnerable represent some of our very top priorities. And as you've heard Dr. Davila say, and as recently as yesterday when Marianne Bedard was here answering questions, I can tell you that the city is responding extremely quickly. These are solutions that are being created around a 24-hour clock. And just to reiterate, very top priority. We're moving very, very quickly, and I'm extremely proud of the amount of work that's been done to date, and we're fully committed to continuing to provide all of the requisite supports for all of our populations, including our most vulnerable.
To follow up, Jeff?
And as a follow-up, just about the powers that the medical officer of health has. Mr. Tory mentioned the bylaw, but is there not a possibility of making a class order for everybody on the stay-at-home orders under the Health Promotions Act or whatever it's called?
So Jeff, it's funny you should ask that question. I assure you, I have asked that question myself of legal counsel, and unfortunately that is not within my jurisdiction to do. So as I indicated in my remarks, I am using the powers that I have available to me, the authorities that I have as medical officer of health, to the greatest extent possible to achieve those goals, reducing the loss of life, reducing the impact, preserving the capacity of our healthcare system to provide for and respond to our needs, and ensuring as much as possible the minimal disruption to social and economic life.
Okay, next up is James Moore from News Talk 1010. Go ahead, James.
Hi, good morning, guys. I need to force the issue with Mark's question from earlier. We've been told today that we've had a 500% increase in COVID-19 cases over the last 2 weeks. The mayor is calling the virus deadly. He says it's an unprecedented threat, and that, the numbers he acknowledges are going in the wrong direction. And so, just trying to understand the discussions that are happening around this. Why not put that bylaw that you talked about earlier into place at this point?
I think because you hope that the measures that have been undertaken today by Dr. Davila, the new announcements that have been made, plus the accumulated weight, I guess, of what we've seen happening as we've tried to, make sure people comply with things as simple as what we've asked them to do to distance themselves in places like parks and playgrounds and streets. There's evidence that there is increasing compliance with this, not just because of enforcement, but because people are figuring it out. They're figuring out our doctor is telling us to do something to make sure we're healthy and that we save lives and get this nightmare over with sooner than later. And so, we've been, I think, doing well as a city at taking these things as they come, working hand in hand with the other governments. You see that the province is enacting a similar measure to us today with respect to the isolation of those that have the virus or that are suspected of same, and people close to them. And these are, I think, steps forward in the context of a coordinated, collaborative, quick comprehensive effort to attack this virus, and there are always other things that you can do, but I think we're putting maximum effort into this as a municipality, and we will see where it goes from here, and not hesitate to do anything that is going to, on the medical officer's advice, enhance our performance.
Follow-up, James?
You mentioned earlier too on this issue that people like bylaw officers, police officers, for example, essentially have better things to do than enforce physical distancing standards. But I mean, you're saying today that lives are at stake in this. So what is more important that they're doing? Especially in the case of, let's say, parking control officers who, don't have parking rules to enforce for the time being. What is more important that they have to do to not do something like that?
It's a good question. If I said better, I perhaps meant other things to do, but they have many things to do. Let's put it that way. And really, it wasn't so much that I was thinking of other things they could do with their time as much as I was thinking that the real impetus for getting progress and getting adherence and getting buy-in to this is going to rest with individual people. I remember the ads that used to be on years ago that said, "You are your own liquor control board." And that was all about drinking. And it was saying to people, you, in the end, make the decision about what you can do to help with a problem, which in that case related to excessive drinking. Well, it's no different here. I mean, we can all sit here and issue orders and make proclamations and do various things, but in the end, it is going to be up to individual people who decide that this is a matter of life or death, if it's not for themselves, it may be for their relatives or their friends or their neighbors or just their fellow citizens, just people who live here in Toronto, and that it is within us collectively to decide, as we must, that we're going to come to grips with this thing. We're going to do what has been recommended that we should do, has been recommended for some time, but in an enhanced way today. And so it's just that all the people who work in the public sector have other things to do in terms of responding to various other issues people face, but none are more important than this. That's a very good point.
Okay, go to Brian Pascagoula from the Toronto Sun. Go ahead, Brian.
Good morning. Just to expand on Mark and James's questions earlier, the measures you've enacted today, is this as far as the city can go in terms of enacting a full lockdown of city residents? Does the city have the power to enact the kind of lockdowns that we've seen in places like Italy, or does that rely on measures that need to be taken by other levels of government?
Well, I'll start by repeating my own words, which I said in my formal remarks, and Dr. Davila has, in effect, addressed it as well, but she can speak, obviously, for herself. I think these measures taken together are about as far as a municipal government can go in trying to make sure that the city is adhering to social distancing and physical distancing as much as it possibly can. I mean, subject, yes, to a tool like the draft bylaw that I made reference to, but I think this is about as far as we can go. But we have been engaged in continuous discussions with the other governments and will continue to engage in those discussions. You heard Dr. Davila say that with respect, for example, to the businesses that are open. But I think in terms of our own authorities, this is, pretty much to the limit. But she may wish to address that in the context of her own responsibilities.
With respect to the powers that are accorded to me under the Health Protection and Promotion Act, I assure you we've explored every opportunity and we are doing everything within my power. I am doing everything within my power to, ensure that we're doing the very best we can in terms of saving lives, reducing the impact on healthcare, and ensuring that we minimize the impact on our society and on our economy as well. So continue to, monitor the issue. If there are specific instances of violation that warrant further action, there is that opportunity to pursue further action under existing public health legislation. But at this point in time, I have maximized the use of my power under existing public health legislation.
Okay, this is as a follow-up. There's been talk of these measures over the past few weeks framed as recommendations, even today in today's press conference. Would the message you're trying to get across resonate stronger if they were framed as orders instead of recommendations?
So as you'll have heard in what I've put forward in terms of new measures, where the possibility of orders exists, I have gone and deployed that authority. I am using the authority that I have to the greatest extent possible. For those areas where I simply do not have that authority, as I've tried to make clear through my presentation, I am stating in the strongest terms possible, that people need to stay home as much as possible. Unfortunately, I can't exercise powers or authorities that I simply do not have, but I can certainly, explain to the members of the public, to the residents of the City of Toronto, how important it is for them to adhere to these very, very strong recommendations that I cannot state in stronger terms. And we've heard from Mayor Tory that in fact it really does reside in each and every one of us to do this. We hope that orders aren't necessary. In every situation, we look and we try to achieve compliance with what makes sense, with what's best for our city through voluntary efforts. We use orders where they're available to us and only when necessary. And when they are not available to us, we actually seek the voluntary compliance, but through the strongest terms possible for our public at this time to stay home as much as possible in order to reduce the impact of this virus on ourselves, our families, and our community.
Right, go to Lauren Pelly from the CBC. Go ahead, Lauren.
Hey there, this is a question for Dr. Davila, unless anyone else wants to jump in. Can you expand a bit more just of how the situation and outbreak in Toronto is impacting healthcare workers from what you've been hearing?
So I can tell you what I've heard personally from healthcare partners and providers throughout the city. There's certainly concern, and this has been carried through the media as well. We've heard many of our colleagues, particularly those who are working in those acute care settings, whether it's in emergency rooms in other parts of the hospital, but I would say with particular regard to those who are working in intensive care units. They are seeing the increased numbers, just as I've reported them today in the last few weeks, and they are incredibly concerned with the level of care that is required by these patients who become very, very sick. I think the picture is even starker, and you can well imagine that our medical community is actually quite well connected globally, more so now than ever. And I know for a fact that the medical community here in Toronto has many connections and ties to the medical communities, for example, in Italy, and certainly closer to home, medical folks in New York City. And the picture there, the circumstances in Italy and in New York City are absolutely dire. So you can well imagine that our medical community, and let me be clear, it's not just physicians, it is all healthcare providers within acute care settings, all the providers who provide care and support to those in hospital, and particularly in intensive care units, are patently aware of the situation in New York and Italy and how serious and dire it has become. Hence the need for us to do everything possible now, while we still have this opportunity, while there's still time, to prevent that from happening. And in so doing, not only will we save our healthcare system, protect it, preserve it as best as possible, but also reduce the loss of life in our city.
Just a quick follow-up to that. We've heard some situations where healthcare workers feel that they are actually being stigmatized by this situation in terms of struggling to rent apartments and things like that. And apologies if you can hear my dog, by the way. What is your reaction to that? The fact that healthcare workers are feeling that, people don't want to be around them, or they shouldn't be renting to them?
Well, I suspect that the mayor may have something to say about that, and how that is not really reflective of who we are as Torontonians. To my mind, the people who are providing service in healthcare settings, those who are providing essential services at this very difficult time, our first responders in the system, just to name a few. These people, as far as I'm concerned, are heroes, and we should be thanking them for their service to the public. So I'm incredibly disappointed to hear that some of them are experiencing stigma of the kind that you describe. And I would suggest to you that, again, this is one of those things that's well within our power as Torontonians. We are an incredible city, an incredibly open city of really amazing people, and I would like to think that folks in our community, Torontonians, would step up and show how grateful we are for the service that these people are providing to us at this very challenging time.
I will just comment on that by saying that we have instances of this kind of behavior where people are stigmatized, and I speak up against it immediately, and I speak up against it knowing when it happens, every single time, whether it's based on religion or color of skin or sexuality, or in this case, people who are heroes that are working for us, that it is a tiny, tiny, tiny minority of people who, for reasons absolutely incomprehensible, engage in this kind of behavior. And they might give their heads a shake and just think about the fact that if somebody in their family, or if them, or their neighbors, or their friends get sick, it is those very same people who they're going to be counting on to help them. These people do God's work for us, and I just hope anybody out there who even thinks about stigmatizing our healthcare workers in that way just understands completely this is unacceptable, this is not who we are, and that we've got to be together on this to fight this virus and to defeat it, which we will do.
Okay, we'll go to Matt Bingley from Global News. Matt?
Hi, Dr. Davila. I'm just wondering, you've already announced some very strict guidelines when it comes to social distancing. So when you say enhanced social distancing, when we already are no longer allowed to meet up with anybody in a group over 5 and are being told to stay at home as much as possible, what is enhanced social distancing?
So, Matt, what I'm trying to get through here in respect of enhanced social distancing is to emphasize to the members of the public the significance, the importance of doing this. And one of the data points that we're constantly monitoring at Toronto Public Health is a general assessment as to how people are complying with the recommendations and measures that have been put out there to date. And certainly, in partnership with you in the media and with many others, we are hearing instances, unfortunately, where the recommendations are quite simply not being adhered to. So what I'm trying to do here today is to make it patently clear, one, why it is that we're saying this. What is the rationale behind these social distancing and physical distancing measures? What exactly is it that we're seeing here in our city in respect of the progress of the disease, and why these actions are necessary on the part of our public? That's what we're talking about, and why it's so important to ensure that people have no misunderstanding or lack of clarity around what is required of all of us in order to beat this virus.
It brings up that discussion about the letter of the law and the spirit of the law. And the spirit of the law, the spirit of what we're trying to do here says that we collectively decide, as we're so good at doing when we want to in this community. We've built up a great city, one of the most admired cities in the world here, through our collective commitment to support each other, to respect each other, to do things that we do to look after each other. And so it is less about what orders say or what recommendations say or what laws say, and more about us deciding we're going to save each other's lives, we're going to keep each other healthy, we're going to get this nightmare over with as soon as possible, and that rests with us collectively. And we will try to lead and try to do whatever we can to support people, but really it rests with people out there who make a decision, starting today, and many decided a long time ago that we're going to defeat this thing and we're going to do it together, and we're just going to get on with it.
Mayor Tory, if I could just follow up on just a question on the bylaw that you've drafted. You did say that it involves city property, and I'm just wondering, does this look at just groups of people, or would it be including restricting access to roads or even having police checks on roads?
It really has to do with people and how they distance themselves from one another. There's already rules in place put forward by the province about groups of people. The medical officer of health has been very clear repeatedly for weeks about groups of people and that not being a desirable state of affairs in many different settings. And so we have that there. We shouldn't get bogged down. This is one of those things where there is that tool We have to do, as I said, with regard to everything that the medical officer of health told us about on the weekend, to then do the work of looking at how you would implement something like this and how you would have some measure of compliance with it. The bottom line is that there's lots of information out there, plenty enough now, telling people whether it's 6 feet, 2 meters, a hockey stick, what they have to do, in terms of avoiding group settings and that kind of thing. And we really just hope people will follow what they already know, and we'll see what else has to be done to achieve the desired result as we go forward.
Okay, back around the horn to Jennifer Pagliaro from the Star.
Hi, for Dr. Davila again. You said a couple of times that you're doing everything now in your powers. Is there more that you think the province should be doing on a regional level, or are there additional powers that you need them to give you in order to respond to the numbers that you're seeing?
So as I've made clear, I hope, through my remarks, there are a number of steps that are being taken by the province. I spoke to the fact that it's my understanding that our provincial counterparts are pursuing similar orders under the Health Protection and Promotion Act as the ones that I've just described today. That certainly, again, from a provincial public health point of view, they are under the terms of the same legislation, at least from the Chief Medical Officer of Health perspective. That Health Protection and Promotion Act also confers powers on the Chief Medical Officer of Health. We've also mentioned that we are engaging in active conversation with our provincial counterparts, as well as our federal counterparts, on how we can collaborate better together in and around enhancing social and physical distancing, making sure that case and contact measures and actions are as strong as they can be. Making sure that we're working together to protect those most vulnerable to COVID-19 and trying to strike the right balance between limiting virus spread and ensuring that essential businesses and services are available for all of us as we need these services and businesses to attend to our needs. I think that at this stage of the game, that it's best for us to continue to work in partnership. And that's not unique to public health practice. I think successfully achieving goals, large goals in complex situations like the outbreak in which we find ourselves, these kinds of endeavors are best done when in partnership with all levels of government. So that's certainly the tack that I plan to take. I know that the Mayor has had active conversation with his provincial counterparts and federal counterparts as well. And, you know, I think we all are working with the singular focus of reducing the loss of lives, protecting and preserving our health care, and ensuring that as much as possible, we seek to minimize social and economic disruption. These are complex, big issues to tackle in the, you know, as we respond to this outbreak. And I think that those complex, big issues are best handled across all three levels of government.
Okay, last question to Christine at CP24.
Thank you so much for taking this final question. The question is for Mayor Tory. Mayor, considering the measures that Dr. Davila is announcing today in the strongest tone possible, and yesterday the announcement of all these city events canceled until June the 30th, also you noted that social distancing measures, your understanding and belief is they'll have to keep up for 12 weeks. People in the city will have to keep up with them for 12 weeks, which aligns with that, June 30th date. Wondering if you can be clear, yes or no, should the school year be canceled?
That's not up to me to decide, but I think that if we're looking at all these other measures, based on the best advice that I have said yesterday and I repeat today, I don't think the environment in terms of people's health, even if we've broken the back of this virus, will necessarily be such that we can afford to start immediately gathering together in large groups and so on. And that's going to be up to professional advisors, and the provincial government has professional advisors that will help them with that. They've indicated a date by which they're going to sort of see if they can have the schools open. I'm sure, like everything else, just like we're doing with all kinds of things, that they're looking at this on a day-to-day basis. It seems to us as if it's going to be a 12-week process us in the City of Toronto, as best we can estimate it, based on the measures that we're undertaking today, and 12 weeks at least. I mean, is that what we're saying? And we're going to try and make sure, if we're all getting together on this and getting into the spirit of doing what we should do for our city, then it could be earlier, could be later, but it's not up to me to make that decision. I think we're setting dates based on the advice we've got here in our own city and what we think is prudent in those circumstances.
Okay, thank you, Doctor. Thank you, Mr. Mayor. Thank you, Chief. Thank you, journalists. We'll talk to you again tomorrow.